The injury. Due to an impact to the lateral aspect of the skull, there is a fracture of the temporal bone resulting in damage to the underlying middle meningeal artery located beneath the temporal bone. Tearing of this artery results in hemorrhaging and an accumulation of blood between the skull and the membranes that surround the brain. The linear fracture of the skull extends downwards towards the ear and then medially towards the base of the skull. Vertigo is defined as an abnormal sensation of rotary movement associated with difficulty in balance, gait, and navigation of the environment. The forces placed on the skull by the impact result in a linear fracture of the temporal bone, which traverses the floor of the middle cranial fossa, the bone that encases the structures of the inner ear. In this case, the fracture could affect the integrity of the bony labyrinth located within this structure. The bony labyrinth encloses the membranous labyrinth located within the semicircular canals. This is the organ responsible for our sense of balance. Such an interruption potentially allows for the movement of perilymph and blood products into and out of the bony labyrinth. These fluid movements would result in pressure changes being exerted against the membranous labyrinth and its contained fluid, the endolymph. These changes would stimulate the receptors responsible for equilibrium and thus result in an altered sense of balance. The fracture itself can also result in physical irritation causing inflammation of the receptors within the inner ear, or the sensory nerves that combine to create the vestibular component of the eighth cranial nerve. This nerve sends signals to regions of the brain associated with balance. Thus, the fracture, movement of fluids, irritation and inflammation cooperatively may contribute to the sensation of vertigo experienced by the patient.